So what's with high arches in the foot? I'm not going to show you my feet. I don't put my feet on camera. But high arches in the foot are when you've got your toes, right? But you've also got your knuckles right here, and then you've got your ankle, okay? So you're standing, I guess you're standing like this, right? Here's your leg. Sorry, I don't put my feet on TV. Here's your leg, here's your ankle, here's your arch, and you've got that one bone that sticks up, and if you're wearing work boots, you're walking and that bone will start to ache because it's just way up, right? And then your toes, oftentimes your toes are gonna be a little bit like twisted, and they're gonna be pulled in toward the heel. So maybe tonight when you get home, you take off your shoes and just kind of look at your feet. Maybe like put one foot up on your other leg. Look at your feet and see, okay, is my big toe kind of like twisted so that like, is my nail nice and straight, or is my toenail actually like more tilted to the left or right, or like toward the inner or the outer foot? Take a look at where the toenail is positioned on your big toe. Is it more positioned inward or outward? If it is, then that toe is twisted. All right? You can take a look at your toes to see if they are curled a bit downward or if they're nice and straight. And if they curled a bit downward and inward, that tells me something about your feet, right? That tells us something about high arches. That even tells us about flattened arches. Flattened arches aren't actually all that different from high arches. They look a lot different, they present a lot differently, but really the approach is very similar in my vantage point. Once I get you on my table, my treatment table, and I start working the foot to get that arch corrected, it's not that different of a treatment between a high arch and a low arch. Just a different outcome. The thing about a high arch is it's very similar to what I talked about with trigger finger. If you haven't watched that video about trigger finger and carpal tunnel, go watch it. I think it'll be very helpful in helping you to understand the role of the calf muscles in the function of the foot and the happiness of the foot. The feet, you know, they won't complain, and then all of a sudden they are screaming at us. And that's not fun. It's like a toothache, it's not fun. We do not want our feet to be screaming at us. We'd rather just prevent that, right? Because then we're limping, we're grumpy. No fun. So don't just look at the foot when it comes to high arches or foot pain. I want you to also look at the calf muscle all the way up to the knee. Okay, look at the calf muscle and also the shin, right? Look at the calf muscle and also the shin. Because it's very similar to the forearm. Your calf muscles have to be anchored to some bone somewhere. Muscles don't just float around in our body. They're attached to things called bones by things called tendons. Tendons. I call those the ropes that attach the muscle to the bone. So when it comes to the calf muscles, and by the way, that big calf muscle back there that you think is fat, it's not, it's a muscle. Those muscles come down and they go past the heel, through the arch of the foot, to attach with a tendon to the tips of the toes. And so what's causing our toes to flex? What's causing our toes to flex? Our calf muscles. Our shins are playing a part, and also there are an awful lot of foot muscles in there. There really are. It gets complicated. But what about plantar fasciitis? That's a common term I hear a lot, and I do find that plantar fasciitis is an easy diagnosis to make for a general practitioner, and so it gets made a lot. I've seen cases of plantar fasciitis that are not true cases of plantar fasciitis, at least not in my opinion. And in those cases, regardless of whether or not it's real plantar fasciitis or not true plantar fasciitis, I don't really care. The approach still is the same because the symptoms are the same. My foot hurts when I walk or stand or exercise. and I want to walk and stand and exercise. Okay, let's fix that. I don't just go to the foot. I go to the calf muscle, which is threefold. You've got your gastroc muscle, you've got your soleus muscle, and then you've got a bunch underneath, the really, really deep muscles. Those are the ones I care the most about. Those are the ones that have the most impact on plantar fasciitis, is those deep muscles underneath the main calf muscles that we always think about. All right, those flexor digitorums, deep, deep in the calf. But I also have to go further up. When it comes to plantar fasciitis, when it gets that bad that it's going to bring someone into a doctor's office, then bring them into a naturopath's office because the other stuff didn't work. So we're going to try something different. By then it's pretty severe. So I've had to get real creative about how I treat the feet. I go all the way up through the hamstring into the hip and into the low back, and I treat from the lumbar spine all the way down. And it's a really pleasant session. There's a lot of manual stretching where I'm actually I'm stretching your heel away from your knee, right? And I'm just gonna stretch, release, stretch, wiggle the muscle, release, stretch, wiggle the muscle out, release. Go to the toes. And I might put a glove on and I might actually pull and stretch the toes. It feels great. It doesn't hurt at all. It's very relieving. And sometimes when I do that, the feet will twitch and those small foot muscles will start to finish their flexion and release. It's the cool thing about the muscles is that when they twitch, they're actually releasing. And so you get that activity and you're like, what's going on? Like, is this okay? Like, yeah, it's definitely okay. It's definitely okay. If you're trembling, if you're twitching, try to allow that to happen because that's the body's way of releasing muscle tension. And if we're not allowing ourselves to do that, and we're continuing to tense up, whether we know it or not, we're going to be setting ourselves up for muscle cramps, our Charlie horses. Where's the most common place to get Charlie horse? Calf muscles. Do you think that's a coincidence? I don't think so. What about restless legs? What about restless legs? Restless leg syndrome. There's some pretty strong medications out there that get prescribed for restless leg syndrome. And oftentimes, I can take care of restless leg syndrome in 3 sessions. If it's a severe case, give me 9 sessions. But that's usually the way that goes. Restless leg syndrome. Might be a little simpler than you think. If you're interested in doing some hands-on care, the thing about me is that my approach to hands-on care is very gentle, but it's also very straightforward and direct. I don't mess around. You'll know after the first session whether or not it's going to help. You don't have to do a whole bunch and decide whether it's going to help. You'll know instinctively after the first one whether or not it's worth continuing. Have a great day.